Hi, welcome to Health Healthcare India Private Limited. My name is Godwin. So we are a telehealth platform. Of course, most of us know what is telehealth. It's there for almost 10 years now. But what we are trying to do is a virtual care technology platform. The next stage or the next level of telehealth, where we are trying to bring patients to doctors much more closer than their physical appearance or the physical presence. So what happened is everybody needs a successful outcome when you meet a doctor or with any other telehealth platform. So, at the same time, what happened is people want high quality experiences. It's no more, it's just a kind of conversation or just a kind of, I would say, it's not just a consultation. They want more high quality experience. What additional we are going to give? So that's what people are looking at. So where are we? So we are at the Android App Store. We are at iOS. You can access it even using a desktop version. So the beauty here is you can have multiple doctor consultation. It's not just one doctor. A doctor can invite another person, maybe his friend want to have another opinion. So on the same consultation, he can invite. So it's a kind of a multiple consultation as well. It's possible. And soon we are going to come out with our own e-commerce marketplace where once a doctor gives a prescription in our platform, it will be sent to the marketplace where the same medicines, whatever doctor prescribed, will be delivered to the patient, as a cash on delivery, or they can pay it before also. At the same time, we are also planning to reach the rural areas, I would say, where I would say the healthcare, the telehealth is still hasn't reached it yet. We want to reach the rural, make sure we reach the entire corners of this country. This platform, our telehealth platform, is free for the doctors. We're not charging anything for the doctors. At the same time, we are kind of having a equality among doctors, where we don't take any kind of an additional fee where to promote the doctors on top. We don't do that. So we want to be fair, and it's like we've seen many applications. So we want to be very different. We want to be very, very close to the patient, where we want to give the top customer experience. So I would say it's a kind of a human touch. That's what makes us so different. We are in touch. Also, we have signed up with other labs where we are trying, and also we are, I would say, connecting patients with labs, local hospitals. So kind of a lot of tie-ups where a patient no need to worry where should go. Nobody's there to advise him to which hospital or which lab he can go. So that's where we assess the same patient to whichever lab he has to see, or the doctors, find out the cost factor, negotiate with the hospital on behalf of the patient. So these are the kind of additional services we provide. In some cases where they could not come here, or they could not able to do a consultation properly, we send our doctors to their homes, where we have a small kit where it almost does close to 60 different vitals. So with that kit, the doctor goes there, understand the patient. It's just not just telehealth. So he does proper testing with the nurse, get the results, and do a proper consultation. Because a lot of people think telehealth consultation is not so, I would say, accurate, or they say you cannot test the patient there. So how will you know when there is no physical doctor? So for that, in that case, we also have a kind of a consultation where you can invite our doctors to your home. So like a home visit. So that's a kind of additional, I would say, support we are providing. And to add more into telehealth, what happened is, of course, we have more than closer to 1,000 doctors now. We have crossed more than 10,000 downloads. As a differentiator, what we recently did is included, I would say, like some of the specialized Ayurvedic doctors all over from India. So what happened is Ayurvedic treatments, a lot of people feel that Ayurvedic treatment, it's a physical, you need to either go meet the doctor or get the medicine from him. So that is a kind of a challenge all over. So we solved that challenge using our solution. What happened is you can select the doctor. Instead of the same doctor come to a treatment, give you a treatment or a therapy session. So we have signed up a lot of therapists across India. So we will recommend one of the therapists. So he will take care of whatever the consultation given by the doctor. He will use the same ingredients or the materials, whatever recommended by the doctor, and the same therapy session will be done at your home as well. So likewise, we have Ayurvedic wellness program, and also we also have mental health wellness program, which is picking up. So it's a customized plan. It's not just kind of I would say it's not just kind of a generic off the shelf. No, we customize to each and every one. Understand the patient, like, and also we understand it better. Find out what are the prior issues they have, so we give a customized wellness program for them. So what happened is, we during the wellness program, for example, if you take a 30 days program, so we have frequent consultation in between. For example, every 5 days you get a consultation as a package, as free of cost. So a lot of things are there in that. So definitely you should try that. So in the recent times, what is happening is we have started focusing on mental health as well. So that's more, a lot of people are asking after this pandemic. So we are having mental health, weight loss programs, dietitians, so we are trying to give the one of the best user experience among the telehealth industry at present in India. So we also believe in integrated data sharing. So we make sure your data have been shared properly to the doctors, then to the e-commerce marketplace. Want to buy medicine. At the same time, you can come in anytime. You can access all your records for free. So in future, we are going to tie up with a lot of wearable technology providers as well as remote patient monitoring. We already started. In future, we're going to bring that also in a kind of a large scale. So also this our patient remote monitoring is very, very convenient, and I would say it's more easier and it's cost effective. So what I would like to tell you is, why can't you try our app? It's Health app. You can go to go to your app store and type Health definitely you will see. If you think you want to do it in a desktop version, you can still do it. So definitely try it. We have offers for the first time users. Definitely you will recommend with the quality of video, with the quality of audio, and the kind of doctors we have. We carefully selected and onboarded some of the India's best leading doctors. We are going to launch in various other countries as well, but initially we started with India. Definitely you have to try that, and we make sure you'll be happy to use that, because health is here to stay. It's not that because telehealth is going to stay here. So that's how we are also going to stay. We are coming out with a lot of our other subsidiaries like e-commerce marketplace, and for the reaching the rural areas, so then Ayurvedic, Siddha, definitely you would enjoy that. So please try Health, our app at the App Store. Thank you so much.